Yeah, so this was the study published in 2009 by the authors, and you can see that they have mentioned a typology of reviews where they have mentioned 14 type of review studies and the associated methodologies. So I suppose you might have gone through or heard about them. These are the 14 review types they have mentioned. Now, I'm not going to go in detail with each one here, but I will talk about these. If you can see, the systematic review, the umbrella review, rapid review, qualitative systematic review, meta-analysis, they are mostly quantitative and they follow a systematic and methodological approach, whereas these literature review, mapping review, critical review, scoping review, state of the art, systematic search and review, systematized review, mixed studies, they are mostly focused towards a qualitative synthesis, but they may or may not follow the methodological approach, right? I'm not going to go in detail one by one. If you want to know about one particular any particular review, then you can ask me, or you can note it down and we can discuss this later in the question answer session. Now, meeting the review family. So that is very interesting. Again, the same group of authors in 2019, they come up with a review family, and according to them, they discovered that there are 48 type of reviews. So can you imagine how much? And then and there were similarities in those reviews. So they categorized these reviews into 7 big families, and which are the traditional review family, rapid review family, qualitative review family, review of reviews family, mixed method review family, systematic review family, and purpose specific review family. So they basically categorize the reviews into each family because those families had some similar methodology or similar approach or similar synthesis. So talking about traditional review family, as we know, as the name suggests, it's a traditional review. It wants to talk, it is basically discovering or talking about the historical perspectives about what has already been done, and it basically follows a narrative approach. So the strengths are that it is basically a purposive sampling. You want to discover, or you want to know about the historical perspective of a particular topic, so you can go for a traditional review family. And it allows flexibility in the literature selection based on the theory you want to discover or the time periods you want to go through. And it is moving towards a systematic approach, but then there is not so much transparent reporting. So the limitations are that the methodology are not explicit, and such type of studies somehow lack formal guidance for research methods. And what studies come under the, or what reviews come under the traditional families are the narrative review, the integrative review, critical review, state of the art review, and even narrative summaries. Next, we have the systematic review family, which, as the name suggests, includes all those review studies which are done following a systematic and methodological approach, following clear guidelines. So the strengths of such reviews are they emphasize comprehensive research methods, they provide clear standards, and they also provide formal guidance. And they include specifically the review, systematic review literature. They also focus, and they want the researchers to include gray literature, which may or may not be in other review types, but systematic reviews family focus on that. And but still, if they want the sources from gray literature to be included, there are disparate guidance of how to go and what type of how to search for gray literature exactly. So the exact methodology or the sources are not available right now. That is still in process. And what review types come under the systematic review family? There are a lot of reviews, systematic review, meta-analysis, but there are other types of reviews which are commonly seen nowadays, like diagnostic systematic review, network meta-analysis, prognostic review, psychometric reviews, and the others. Right? The review of review family, as the name suggests, these type of review includes those review studies which review other review studies. So review of review means they review the results of these studies are based upon the other existing review studies. So, and they prioritize systematic reviews. There is a consistent guidance on how to search and how to do that, and somehow the review of reviews family methodology also overlaps with the systematic review family. But however, saying that, there are still lack of informed search guidance, and the methods are mostly disseminated via publications and conferences. The review of review families are mostly the review of reviews and umbrella reviews. Rapid review family. Now, this is interesting. Rapid review families are basically a new or a very recent development. And as the name highlights, why are they saying it is a rapid review? Because it is something which is done in a short period of time or having some constraints as demanded. So, but they are type of a systematic review itself. So such rapid review, they allow or they provide flexibility to modify the process. They allow for abbreviations or deviations from the conventional systematic review, but and there are limited iterations, a minimal validation. You have the chance of going for a small group of study. So that is the reviews basically. So that is something which can be done in a small, short period of time. And that's exactly the limitations also, because you search a limited number of database, so you restrict to the secondary sources or the existing reviews because of the time saving methods. And rapid review have been recently very much into publications, and you can go through the internet is full of rapid reviews, especially related to COVID-19, when the policymakers had to come up with solutions in a short time, because it was a pandemic. So at that time, there was since it was limited time constraint, resource constraint, rapid reviews were a great rescue. And the reviews were basically rapid review, rapid evidence assessment, and rapid realist review. Next is the qualitative systematic review family. So it includes a systematic review, but those reviews which follow a systematic method but do a synthesis in the qualitative form come under these review family. So they offer a variety of review types, and they can basically, since they are doing a qualitative synthesis, so their focus is mostly on the contextual and theoretical role in the review process. And as it is known, since it is qualitative, there is a methodological limitation. And depending upon whether you want to go for an aggregative review or you want to go for an interpretive review. Now, aggregative review is something where you want the researchers, they combine the results into quantifiable manner, that is in a numerical manner, whereas interpretive review is forming theories and models. So there are limitations of this study, that because they are doing a systematic review, so which to follow. So there are differences in that. So that is one of the limitations of a qualitative systematic review family. And the type of reviews which come under this family are numerous. You might have read meta family is basically a qualitative systematic review family, accepting the meta-analysis. So meta-aggregation, meta-ethnography, meta-narrative review, meta-summary, meta-study, all these are part of this family. Now coming to the sixth family, which is the mixed method review. Mixed method is something which tries to integrate and explore both mixed quantitative and qualitative data. So it emphasizes or tries to combine both. So it may have method papers also and sibling papers. So now what are sibling papers? Sibling papers are something, a qualitative study set up in a similar setting or in the same setting is a sibling paper. And for triangulation is something where you want to come out with a theory. So you want to also follow the qualitative aspects, the review and the synthesis, and you also want to follow a quantitative review and synthesis. So that is why it is a mixed method review family. And obviously there are challenges in retrieving these studies, and mostly it is a clustered approach. And the type of reviews which come under mixed methods are meta-narrative reviews, Bayesian meta-analysis, EPPI center reviews, realist reviews, and they're usually less seen because it's really time-taking and consuming to do these reviews. And the last one is the purpose-specific review family. As the name suggests, they are tailored for specific purposes and domains, and they are mostly client-centered, or they are mostly demand needed. So this is some types, like example, health technology assessments, they use this type of diverse systematic review search methods. And the type of reviews which come under this review family are scoping reviews, mapping reviews, systematized reviews, concept synthesis, and the others. right? So now, by now, I suppose you have come across quite a number of types of reviews. So when you search the literature, when you go on the database and you get to see so many type of reviews, it's really confusing to understand which is what. So that is why I have given you an overview of this family, and I hope that with this you have a clear perspective now. Give me a thumbs up in if it is clear till now.